A lung infection is just what it sounds like, an infection in one or both lungs. There are a few common types of lung infections. One of the most common is pneumonia. Pneumonia affects the small air sacs in your lungs. It is usually caused by bacteria that can spread from person to person, but it can also be caused by a virus or fungus. You can catch pneumonia by breathing in the bacteria or virus from someone who has it. This can happen if that person sneezes or coughs. A lung infection can be caused by a virus, bacteria, or sometimes even a fungus. When the large tubes that carry air to and from your lungs get infected, it's called bronchitis. Bronchitis is usually caused by a virus rather than bacteria. Viruses can also infect your lungs or the small air passages leading to them, which is known as bronchiolitis. This type of infection most often happens in babies. Lung infections like pneumonia can be mild or severe. They tend to be more serious for people with weak immune systems or ongoing health issues, like chronic obstructive pulmonary disease. In today's video, we're diving into the 8 early warning signs that you may have a lung infection. Coughing with mucus can be a sign of diseases like bronchitis and pneumonia. Your lungs are spongy and made up of tiny air sacs, making them the only organs in your body that can float on water. Infections are usually caused by bacteria or some viruses that lead to pneumonia. Bronchitis is more common than pneumonia, affecting nearly 9 million Americans each year. The main job of your lungs is to take in fresh air and remove waste gases, which happens through large bronchial tubes. If these tubes get infected, it can lead to bronchitis. An infection can cause thick or sticky mucus as a result of inflammation in the airways and lungs. This mucus can block normal breathing, triggering your respiratory system to make you cough. Both bronchitis and pneumonia often produce thick mucus that can be clear, white, green, yellow, or gray. It's important to pay attention to the mucus coming from your nose and mouth. If you notice streaks of blood, it's a serious concern. When the infection starts to go away, the mucus will stop, but you may still have a cough. It can take a couple of weeks to feel completely symptom-free. If you are finding this information helpful, please give it a like and subscribe to stay updated with the latest health and nutrition tips. Chest pain while breathing deeply can indicate a serious infection. During lung infections, you might experience one or more symptoms at the same time, and coughing is likely. The chest pain can feel sharp and stabbing, and it may extend to your mid and upper back. Your lungs are paired organs, but the right lung is slightly larger than the left to make room for your heart. Any pain in the chest area should be taken seriously. Your doctor will perform several tests to make an accurate diagnosis. They will review your medical history and ask about your job, recent travels, or exposure to pets or animals. A physical examination, including checking your vital signs and temperature, is standard. If the initial exam isn't clear, you may need a chest X-ray or CT scan. Doctors might also take samples of nasal discharge, mucus, and blood. A pulse oximeter can be used to measure your blood's oxygen levels, and a specialized test called spirometry measures how much air your lungs can inhale with each breath. Your body is like a miraculous machine, but it can overheat when it's working hard, especially during an infection. Normally, your body temperature is around 98 degrees Fahrenheit. However, when you have an infection, your body raises its temperature to help fight it off. If you have a bacterial lung infection, your temperature may rise to around 105 degrees Fahrenheit. It's important to monitor your temperature, especially if it goes above 102 degrees Fahrenheit. Along with a fever, you might experience symptoms like sweating, chills, muscle aches, dehydration, headaches, and weakness, which can come and go with the fever. If your fever reaches more than 102 degrees Fahrenheit or lasts longer than 3 days, it's important to see your doctor, as this is a warning sign. A lung infection can cause inflammation in your muscles, leading to painful body aches that can range from your feet to your head. The pain may be caused by various microorganisms, including bacteria and viruses. While lung infections can also be caused by fungi, this typically affects people with weakened immune systems due to certain illnesses or medications. A runny nose is one of the more annoying symptoms that can affect anyone. That's why it's important to cover your mouth and nose when sneezing or coughing. Infections can cause similar symptoms to the flu and can appear quickly. To help you recover faster, try some home remedies like drinking plenty of water, having hot tea with honey and ginger, gargling with salt water, inhaling steam, and using a humidifier. Take a break from work and exercise and rest as much as you can. If your doctor has prescribed medication, make sure to take it. If the infection is bacterial, antibiotics can help you feel better. If a fungus is involved, you may need antifungal medication. Antibiotics won't work for viral infections, so you'll have to wait for your body to fight it off on its own, relying on your immune system. In very severe cases of lung infection, hospitalization may be necessary. Shortness of breath means you're not able to breathe fully and your breathing may feel strained. How well you can breathe depends on your lung capacity, which can be affected by infections. Regular exercise can help improve your lung capacity, allowing your lungs to expand and supply more oxygen to your body. Most athletes and fitness enthusiasts tend to have a greater lung capacity than the average person. Wheezing happens when the airways narrow, reducing the oxygen your body can carry. When you breathe in, you might hear a high-pitched sound coming from your nose, which doctors refer to as wheezing. For adults, wheezing can be serious, especially if it's accompanied by other symptoms like confusion, trouble breathing, a stiff neck, chest pain, vomiting, unusual skin rashes, or hallucinations. Blue skin and lips can indicate that your body is getting a poor blood supply, especially during a severe lung infection. Blood that is rich in oxygen is light red, while blood without oxygen turns dark red. When this dark red blood reaches your lips and skin, it can make them appear blue, a condition known as cyanosis. Cyanosis is often more noticeable in people with fair skin, but those with darker complexions may see their lips and skin appear gray or white, and it can also affect the nail beds, fingertips, and areas around the eyes, nails, and gums. To prevent these serious complications, it's important to manage lung infections by following good hygiene practices. Wash your hands regularly, avoid touching your face and mouth, do not share utensils, food, or drinks, and try to stay away from crowded places unless necessary. Avoid smoking and make sure to get flu shots when they are available. If you've noticed any of these symptoms, don't hesitate to reach out to a healthcare professional for guidance. Early detection can make a significant difference in treatment outcomes. We hope this information helps you and your loved ones stay safe and healthy. If you found this video useful, please give it a thumbs up, subscribe for more health tips, and share your thoughts or questions in the comments below. Thanks for watching, and take care.